Hello there and welcome to Southend Maternity Unit. My name's Jessica and I'm going to be taking you on a virtual tour of this unit. Enter main reception on the ground floor and, having used the hand gel, follow the maternity signage in the orange zone which takes you to the bank of lifts. Take the lift to the second floor, turn left and use the buzzer system to enter the main maternity unit. The instructions for the buzzer can be found here on the wall. This includes antenatal, postnatal, midwifery-led unit, consultant-led unit and the fetal medicine unit, where our maternity team will welcome and support you. For scheduled appointments, you will need to come to the women's clinic. Enter the hospital via the back entrance number 5 on Carlingford Drive. Then head towards the Nightingale Centre. The directions are on the yellow signage. Once inside, report to reception and they will direct you to where you need to go. The women's clinic is a shared clinic where pregnancy and gynecology care are given. The fetal medicine unit is where the majority of routine scans during your pregnancy will take place. Occasionally, some scans are undertaken in the women's clinic. Your midwife or the receptionists will let you know where to go. If you do need to stay in hospital while you're pregnant, it's most likely you'll stay here in our antenatal ward at Southend. This is known as MB1 or Margaret Broom 1. Your care will be reviewed regularly during your stay and any plans for managing your needs will be made with you. You can ask for additional information at any time from the doctors, midwives and maternity care assistants. Visiting arrangements have been subject to change recently, so it's always worth asking the staff during your stay about local arrangements or checking the website or with the MNVP. When you come in to give birth, the triage area is where you will first meet your midwife and establish how your labour is progressing. The midwife will discuss with you the most appropriate place for you to be and help you identify your needs and plan your care. We use a very specific review system called BSOTs within our triage, which is designed to enhance safety and improve the experience for women and birthing people at our 3 main sites.
Hello, my name is Kate. I'm one of the matrons at maternity here at Southend. We have birth preparation classes here at Southend. They can be accessed via our website or by speaking to one of our midwives directly.
The midwifery-led birthing unit is called New Beginnings at Southend. A midwife-led department is designed for women and birthing people with no anticipated complexities who choose to give birth in a non-medicalised environment. If you choose the birthing unit for the birth of your baby, you will be cared for exclusively by midwives. We actively support those who wish to use yoga, breathing techniques, relaxation techniques and complementary therapies. We have 4 birthing unit rooms, one of which has access to a purpose-built birthing pool. The pool has a calming and relaxing effect. It is very popular for both labour and giving birth in. The rooms are designed to encourage you to feel comfortable and to help you maintain active throughout your labour. Often, people in labour will use a variety of different positions and birthing equipment, such as floor mats and balls, to enhance that birthing experience. The consultant-led birthing unit is where doctors and midwives work together to support birth. The consultant-led birthing unit is known as the Central Delivery Suite at Southend. Here, midwives work closely with you and your family to support you through the birth of your baby.
Hello, I'm Ian Chan. I'm the consultant obstetrician in Southend Hospital.
Here at Southend Maternity Unit, there is a philosophy about promoting the physiology of childbirth in order to achieve the best possible outcome for your pregnancy.
There are obstetricians, anaesthetists and neonatologists who are always available for women and birthing people who choose to have epidural, or they may have developed complications of pregnancy, or they just simply have more complex pregnancies.
The consultant-led birthing unit at Southend has 6 individual labour rooms and 1 purpose-built birth pool. The rooms are designed not only to be comfortable in labour, but also to house all the medical equipment we may need for more complex births. Just as in the midwifery-led birthing unit, all women and birthing people in the consultant-led birthing unit in labour have one-to-one care with the midwife. You will be able to adapt the environment with lowered lighting and use of a variety of equipment such as birthing balls to promote active labour in an environment that also supports the physiology of your birth. You can discuss active birth positions and ways to stay upright, as well as rest at any time with the midwives and doctors caring for you. Sometimes the safest option for you and for your baby is to have a caesarean birth. If you have a planned or an emergency caesarean birth, this will take place in one of our theatres based on our central delivery suite. Following your birth, you will move from theatre to the recovery area with your baby and birth partner until you're ready to move on to our postnatal ward. Most new parents and babies will be ready to go home soon after birth, either on the same day or the day after. However, some will benefit from admission to our postnatal ward for ongoing care after birth. Margaret Broom 2, or MB2, is the name of the postnatal ward here in Southend, and this ward has 25 beds. There are a few individual rooms that have ensuite bathroom facilities, which are offered to parents who have specific clinical needs. The midwives, maternity care assistants and doctors will provide the help, advice and support you need during your stay. You may also receive care from the neonatal doctors, physiotherapists, hearing screening teams and infant feeding specialists.
Hiya, my name's Elifie. I work here at Southend Hospital. I'm part of the infant feeding team. We are level 3 BFI accredited and we're here to support your choices however you choose to feed your baby.
Whichever feeding choice you make, you should feel confident feeding your baby in a responsive way before you go home and can expect to be supported by the ward staff in this. You will get continued support with feeding from your community team, and should you need further support, they are able to refer you to our specialist infant feeding teams if required. The MNVP is the Maternity and Neonatal Voices Partnership, and they are committed to hearing and sharing the voice of all women and birthing people in order to ensure that maternity services are shaped and designed around your needs. They welcome new members and can be contacted by email. We hope you enjoyed the tour of Southend's maternity unit. For more information, please visit the website or speak to your midwife.